Good afternoon.
Good afternoon, Mr. Olekas. Good afternoon, everyone. Just looking at the count of the participants that are currently being admitted in.
Okay.
But I suppose we can kick off already. It is about time. Good afternoon to everyone. My name is Panagiotis Haslaridis, and I'm policy advisor at the European Federation of Allergy and Airways Diseases Patients Associations at IFA. I will be the moderator of this virtual event organized in the framework of the European Parliament Interest Group on Allergy and Asthma. Well, over the 5 years of its existence, the Secretariat of the Interest Group, which is run jointly by IFA and the European Academy of Allergy and Clinical Immunology, IACI, has worked closely with MEPs to promote allergy and asthma health in Europe and make the group a well-recognized forum of health prevention and health and care expertise, but also patient-centered policies. Today it is actually a special occasion as we launch the youth branch of the interest group, the Allergy and Asthma Youth Parliament, and their policy recommendations. This is actually the culmination of 1 year of hard and collaborative work driven by an exceptional group of young people from across Europe who have shown great commitment and great vision in putting together this document with recommendations. A work done also in natural and strong partnerships between patients and doctors. Before we kick off, a couple of housekeeping notes. Well, this event will last about 1 hour and a half and will have 3 main sessions. During the presentations, we encourage the audience to participate with questions or comments that you can post using the question and answer function in the bottom of your screen. We will be taking those on board as we advance, especially the ones that are most voted or most liked, and they will be addressed to the panelists during the roundtable later on. In case of a technical problem now, please leave a comment in the Q&A function as well, and my colleagues Eleanor, Max, and Isabel will guide you through. Now, if you wish to react to this event, we are on Twitter with the hashtag that you can see on the slide, hashtag EP Allergy and Asthma. And please do not hesitate tweeting in your own language. We are delighted that at this moment we see there are 84 participants following this event. So I would like to announce that this event is being recorded so that the launch will be watched. One will be able to watch the launch later at IFA's YouTube channel, which you can find at www.ifanet.org. Now, how about starting with a quick poll, just as a warm-up? The question reads, to what extent do you think the EU is addressing allergy and asthma? As you can see, the options are fully, more or less, could be more, not at all, I don't know. Everyone can vote on this poll, so please feel free. If everyone is fine with their responses, let's maybe have a quick look at the results. Max, can you help me? Votes are coming still. Do we have the results? Okay, so we have all the options chosen with 65%, 37 of the participants said that, in fact, more can be done to address allergy and asthma in Europe. 12% say that more or less Europe is doing fine. 11% say that they don't know. 7% say that they are fully satisfied with EU's performance in addressing allergy and asthma. And 5% say that not at all. Now, without further ado, let's just go to the opening part presented by our co-chair, member of the parliament, Tilly Metz. Unfortunately, Mrs. Metz could not be with us in real time, but has nevertheless sent us a video statement instead. Well, Eleanor, if you can launch the video, please.
Dear young patients, medical students and professionals, dear EFA and EAACI leaderships, dear all, I would like to welcome you all today in this event of the European Parliament Interest Group on Allergy and Asthma. It is a particular honor for me to co-host this event and to present a set of recommendations that have been entirely designed and driven by young people in Europe. I'm really glad to welcome this youth leadership to the European Parliament. This is your house. For me, this has all come very natural. Even it's only recently that I became a member of the interest group of allergy and asthma, as well as one of the vice chairs of the group. I was myself suffering from asthma when I was a child and remember all about it. I am truly sorry that I cannot be there with you in person today and in real time due to a heavy workload. But I'm happy to at least be able to address you through this video. Allergy and asthma are chronic diseases affecting an increasing number of Europeans each year. They are not secondary diseases. They are a real burden affecting those who live with them, and children, teenagers and young adults bear a disproportionate burden, as allergy and asthma are much more prevalent in these age groups. 1 in 4 children below 10 years old lives with an allergic disease, and some of them will continue carrying this disease throughout their life. Thanks to the recommendations that you have prepared and we are launching today, it is clear that young patients' needs and concerns are distinct from older patients. Different way of lives, qualities and capacities call for different solutions. Take, for example, the relationship with technology, which can be a significant tool to manage a chronic disease such as allergy and asthma, and how it has improved from generation to generation. However, I have the impression that we, as politicians, are not doing enough to reach out to the youth, engage with them, discuss their problems, and importantly, involve them in the decisions affecting their life. Ensuring our young population feels involved and well informed is key in building active citizens. For me, it is clear we need to be on their side and prove in practice that we are working for them too. We need to integrate your youth perspective in our daily considerations. Unfortunately, children and young adults often have to face public ignorance about their diseases and even social discrimination because of them. Therefore, public awareness is another important field that we need to cultivate by investing meaningfully in training and education to ensure that young patients' life as normal as possible. The recommendations of the Youth Parliament on allergy and asthma are based on principles that are very close to my heart. On one hand, As a proud member of the Green Party, I fully share the desire of young allergy and asthma patients to live and work in safe environments. When it comes to our living environment, there is no ambition high enough in our effort to eliminate air pollution, both indoors and outdoors. Every citizen has a right to a healthy environment. This has been a key political battle for the Greens over the years. Moreover, allergens in food and other consumer products are a key concern, and therefore information should be clear, timely and uniform across the European Union. On the other hand, as a devoted European, I am convinced that only European solutions that cut across member states, can have a true impact on our lives. After all, most of the challenges linked with allergy and asthma, such as air pollution and access to quality healthcare, cannot be limited within a single country and call for holistic cross-border remedies. This brings me to the last point, the need to act to ensure access to care. In the context of the new pharmaceutical strategy and an increasing dependence on data sharing, safeguarding and high quality in diagnosis, treatment and care across the European Union is a major challenge. For example, increasing the standardization of digital tools can have tangible benefits, especially when it will be possible to use it across borders. In addition, we also need to support research towards better treatment and care outcomes, research that fully integrates young people's concern and adapt a personalized approach. That's why I would like to congratulate you for putting your hearts and minds together, paves the way for a better quality of life for youngsters living with allergy and asthma. I appreciate that your work is ambitious, yet realistic with clear, actionable points. I would like to thank the Secretariat for the honor and the trust in my work, and to express my hope to work closely in the future on all matters of common interest. I wish you a great event. Bye.
Excellent. We thank Member of the Parliament, Tilly Metz, for her commitment and refreshing words. Special thanks also because she's the first member from the political group of the Greens to join the interest group in this new mandate that started in 2019. In the meantime, I would like to also welcome Honorable Member of the Parliament, Juozas Olekas, who is connected already. Mr. Olekas has also joined the group recently as a Vice Chair. Mr. Olekas, thank you for your participation and look forward for our discussion during the roundtable later on. Welcome. Now, let's turn to the main part of our event. I would like to give the floor to the IFA President, Michaela Odemir, and Monica Volini, a member of the Youth Parliament, who will introduce us into the journey of this project and what actually it means for young patients. Michaela, you have the floor. Can we unmute Michaela?
So, I give it a third try here. So thank you, Panayotis. A warm welcome to all of you from my side. In my case, from a cold and a bit snowy Örnsköldsvik in Sweden. I hope you are all well, safe and healthy. It is a great pleasure for me to be part of this meeting and welcome so many interested participants to the event of the European Parliament Interest Group on Allergy and Asthma. Those who follow the Youth Parliament initiative from the start in February 2020 know that we have planned to welcome you all in the European Parliament in Brussels for discussion in person, yet with the COVID-19 pandemic, And being a chronic disease patient among the most at risk, we must adapt. So I have the honor today to welcome you all virtually to this launch event. I would like to especially thank the member of the European Parliament, Sirpa Pietikäinen and Tilly Metz, for kindly hosting this event and for their work as members of the European Parliament Interest Group on Allergy and Asthma. Thank you even more for your support for this thrilling initiative to the European Allergy and Asthma Youth Parliament. You know, I am a mother with 3 children, or actually 3 young adults, and they all have allergies and asthma, and it is difficult to live with a chronic disease as a child and a young person. Oh, someone is talking more. There's a lot you want to spend your time on and you want to learn and do, but at the same time, there's a chronic disease that impacts and restricts your life. I'm a patient too, and I know firsthand how allergy and asthma can be limiting, exhausting, and even depressing. At IFA, we are engaged to make changes at European level so that patients can have better lives. We have 3 pillars of work to inform decision makers and patients about our diseases and prevent the risk of becoming a patient, and care to achieve goals to access the same high quality care for everyone. I'm glad to see that our work at IFA is now taken on board by the young generation. Their engagement is so important, and to show what matters for young patients and how they can be supported best. We need them, and we need you, the young patients following us today's event, speaking directly to the policymakers about your life and your needs. It is not possible to find sustainable solutions for the disease management, treatment, and care without involving those who are affected. Young patients have different needs and priorities or disease management and care. They might require different solutions. This issue clearly stands out from the Youth Parliament's policy recommendation that we are launching today. The key priorities for young people are digitalization, independence, and affordability. To address these asks, we need a future-oriented and fit-for-youth European health policy framework and an approach that involves young people in decisions affecting their health. The past has shown that indeed things can change and evolve. I remember 21 years ago in 1999, IFA had already initiated a young patient group. Can you guess what their words were back then? It was smoking inside restaurants, offices, and on public transport. They were also concerned about the lack of proper food allergen labeling. The situation has changed, but indeed information and advocacy and patient at the forefront. Already then, the youth were also a watchdog pushing for change. Today, they bring new challenges. Still now, stigmatization and public ignorance have a big impact on patients' life. Public information campaigns to raise broader knowledge and understanding of allergy and asthma are indeed to prevent discrimination and social isolation of young patients. Improved and standardized rules on precautionary allergen labeling, as well as staff on the hospitality sector, bring knowledgeable and allergen management in necessary to prevent accident among food allergy patient reaction that can lead to death. I know I nearly lost my son due to that. And digital solutions for young people need to be high in the healthcare agenda. They are expecting improved and more flexible treatment and care via digital means. They are the digital generation. It is expected by 2025 that 1 in 2 people living in Europe with allergy. Therefore, a stronger EU mandate and action on health can boost our responses as a union. I am glad to see with the Youth Parliament the next generation on allergy and asthma leaders in the EU getting prepared to advocate for change for patients. On behalf of IFA and our member organization in 24 countries, I want to thank the participants of the Youth Parliament for their engagement and congratulate you on your recommendations paper. your guide for change. Now I would like to give the floor to Monica Bologna, member of the Youth Parliament, who can provide you with an insider view on this journey of the European Parliament over the past 10 months. Monica, over to you.
Need to unmute.
Monica, can you maybe unmute yourself?
Sorry about that.
Great, no worries.
Thank you, Michaela. My name is Monica Bellini. I am a Spanish and Italian 17-year-old living in England with several food allergies and hay fever. For me and my colleagues from the European Allergy and Asthma Youth Parliament, it is quite a new experience to be part of such an event. On behalf of the whole youth group, I would like to thank members of the European Parliament Sirpa Pietikäinen and Tilly Metz for kindly hosting today's event and being supportive of our initiative. I would also like to thank you all for taking the time today to listen to our recommendations on how EU policymakers can support young allergy and asthma patients in Europe and help them lead better lives. When I joined the Youth Parliament, I was unsure of what to expect, but when we met on Zoom for the first time, I realised that we had a lot in common. We all live with a chronic disease, many of us have done so since childhood, and we felt compelled to become active, share our reality, and communicate about it so that those that can help us change things are aware of the issues affecting our health and quality of life. For me, it is great to see how the Youth Parliament's group evolved over the last few months. We started as a group of youngsters living with allergy, asthma, and atopic eczema, coming from 9 different countries. After hours of virtual meetings, I feel that we have become a community eager to improve the way young patients live like us through Europe. In this Youth Parliament, the average age of participants is 21, so we are not that young anymore, but we do know what it means to grow up with a chronic disease. There is a physical and emotional impact when you handle allergies and asthma throughout childhood and adolescence. We know what a struggle it can be to travel freely for work or for university, whilst being bound to the inflexible nature of our long-term treatment and care. And we know from our own experiences how limiting it can be to live with allergies or asthma in an environment that is not equipped to accommodate our needs and offer us support. Our deep understanding of the problems young patients face has informed the 2 main thoughts for the Youth Parliament's initiative. The first is that young patients have different needs and priorities than adult patients on disease management and care. Consequently, over the last couple of months, our discussions have focused mainly on issues related to personal independence, affordability, and flexibility of medicines and treatment, as well as technology's role in these areas. Today, almost nothing can exist without technology. Unfortunately, though, when it comes to disease management, digitalization is far from reaching its full potential. While e-prescriptions are slowly starting to roll out across Europe, digital health records and video consultations with our doctors, just to mention 2 things, are not yet an option for all of us. As a smartphone generation, we believe that we should be actively involved in the discussion and innovation on digital health, since they will affect how we live with our diseases over the next few decades. Next to digitalization, as young Europeans, we are encouraged to move around and explore other countries through travel, study, and work abroad. It might sound ordinary to many, but this is a privilege that those living with chronic disease cannot always afford to indulge in. In our view, we need a progressive European health policy framework that makes such opportunities accessible for the young chronic patients and that considers our financial status. The second focus of the Youth Parliament is that young people's opinions need to be heard much more, both by the broader public and policymakers. As young patients, we have a lot to say, and we wish to connect with you to give our ideas the platform that we feel they deserve. Personally, I am very grateful to have the opportunity to speak in this event today. I have found a strong sense of purpose and fulfillment through my involvement in the Youth Parliament, and I'm really proud of the progress that my colleagues and I have made. My colleagues will now provide a more concrete and detailed overview of the recommendations that we have prepared over the last couple of months.
Thanks a lot. Thank you, Michaela. Thank you, Monica, for this introduction and for actually describing in a nutshell what the Allergy and Asthma Youth Parliament is all about. You also perfectly set the scene for the exciting presentations to come. So what are indeed these policy recommendations? How have they emerged? What is their focus? How can they support young asthma and allergy patients live better lives? Well, the members of the Youth Parliament have charted the main aspects of allergy and asthma health in Europe. This exercise has resulted in a scheme of 3 main action pillars: inform, prevent, and care. Inform because raising awareness and involving young patients in decision-making is really key. Prevent because young people are more likely to be exposed in harmful environments. And care because there is an urgent need for a youth-friendly provision of care, including via digital means. The policy recommendations have already been uploaded in the interest group webpage, which can be found in www.allergyasthmaparliament.eu. But now let's hear from the actual authors, the members of the Youth Parliament, further elaborate on these aspects. Over to Francesco Russo from Italy, who will discuss about Inform. There you go, Francesco.
Do you hear me?
We can hear you, yes, and now see you too.
Okay,
perfect.
That's perfect. So, hey everybody, good afternoon. I'm Francesco Antonio Russo, coming from Italy. I'm 18 years old, and I study aerospace engineer in Naples. I'm affected to a lot of allergies, including milk, peanuts, and much more. And I have been informed about this project thanks to the Food Allergy Italia Association, who helped me a lot during this period. So I have to thank you for first. Then also to the IFA and all my group that support us. And so thank you all for this kind of opportunity. Today, I want to talk about the Inform part of this project because we work a lot and think a lot about that. We know that Inform as you said before, that Inform is the most important part of this project and this kind of approach. You know, people have to be informed and they have to be involved in your decisions for our diseases. So that's the main point. We worked to several points. So let's see what we did during this job. The first point, the general discomfort because of our diseases. Every kid, every young patients, but also adult patients for sure, are discriminated because of our disease. Taking my experience, I wanted to be an exchange student in the US, but the society discriminated me for my allergies. So the problem is that probably we should be let our situation be more peaceful and normal as possible to give us the most normal life experience and grow up as everyone. For sure, young patients, young people are the future, will be the next generation, the working generation. So having the same opportunities will be fundamental for our growing up. And the point is that probably we don't use the right way the social media in this sense. I know, in every kind of argument, we can say that social media are used also a lot to discriminate people, but we can use it as a strong vehicle, trying to get informed a lot of young patients. You know, Instagram and YouTube are just two simple example of how the information can grow up very strong and very easy with such as some lives and some virtual events such as now. But we are not to be the lucky guys that could be a part of this project. We have to involve everyone, and I think that social media could be the solution of this problem. Putting them on the center of the discussions will be fundamental, and doing it with social media will be very, very easy. Having the first experience, hearing the first experience from the kids and the young patients who are suffering this kind of situation will be great. We are on the front row in this sense, and so I guess that if we are ready to hear new experience, our experience, probably something will change. Will be globally change also using schools, as we said after in this slide. Thank you. The schools are probably the physical center where education could be grow up. I mean, students are there to learn, to study, to learn new things. But also teachers can hear something new, and so we can have a lot of we can have a great matchup between the younger people and the older people, and they can hear us and maybe learn something more. For example, a teacher is also a parent, could be the father of his child or mother of his child, and maybe his child, her child could be allergic. So probably having real life events in this sense could involve them to reflect about our situation. Then finally, we thought that that would be fundamental to show some stats to everyone, not only to young patients, not only to adult patients, but to everybody in Europe and I think also globally. I mean, if they heard numbers, as we know also with COVID-19, for example, probably situation could be more understandable, and maybe that could be not underrated, as I heard a lot. But also, we don't want that there could be so that the gravity of this situation could be more and more. We want to normalize that. We want to be normal. We are normal as everyone. So basically, we need to keep the focus about these two kind of aspects of the argument. So then finally, rapid resume about our goals, about the inform part. Open challenge for open discussion. As I said before, live events such as Instagram, YouTube, but much and much more. So then including young patients to your and our decisions for our health, increasing the social relationship and collaboration between doctors, young patients, adult patients, and more and more. Regular debates and meetings, such as we had during this period with Youth Parliament. We don't want to be the only one. We want to involve as many people as possible and make the word diffused. And finally, support the Allergy and Asthma associations. As I said before, I was informed about this project thanks to an association, and they do a great job for us. So we need to support them. So thank you to hear me. I'm really proud to be part of this reunion, and thank you all to hear me.
Thanks a lot, Francesco, indeed. Now I would like to give the floor quickly to Laura Stenz from Germany, who is going to tell us about the prevention of risk factors. Over to you, Laura.
Hello, I'm Laura from Germany, as you said. And before starting with the slides, I would like to tell you why the issue is important. Why do we need prevention, and why are environmental health factors important, especially for children? Because children, they cannot simply move if something is wrong with their environment. Like adults, they have the money, they can move, and they can change their job if something doesn't fit, but children are dependent on the system. So this is why we need you to act so that the children get the environment they need. Next slide, please. Okay, for the environmental factors, indoor and outdoor air pollution are crucial for us because they make our symptoms worse. There is every year 400,000 annual premature deaths in the EU because of air pollution. So it's the single most deadly environmental health risks. The Eurobarometer therefore places climate change, air pollution, and waste as the three most important environmental issues for young Europeans. This also means pollen are getting stronger and the time that the pollen season is getting longer. Therefore, we should address climate change and air pollution, because otherwise more people will suffer from allergies and suffer more. We urge you to fight climate change and air pollution. Major emitters are transport, industrial, and the building sector. Therefore, we need a mobility change. We need investment in rail and regulation against SUVs. Also, we need a renovation wave, which brings me to the next point, which is the indoor triggers. They're moldy, damp, and badly ventilated buildings are an issue, especially for children, because they cannot flee. So this is where we really need a renovation wave in a social, just way. Also, tobacco smoke is an issue, and fabric in furniture in schools and public transport. I think you will probably not know this, but there can be dust mites, pollen, and pet hair in these furnitures. And children cannot just buy a car with leather seats, or so they are dependent on what is there. So we should really make public transports and public places accessible to children with, for example, fake faux leather chairs or furniture. Yeah, we need awareness about this. And we also need digital tools, because they can generate knowledge on crucial risk factors, such as the different pollen seasons or outdoor air pollution, or even can be a self-help group. Now we're coming to food and consumer products on the next slide. The PAL system, the precautionary allergen labeling, is not everywhere based on standardized rules, which can be fatal for us. So we would really want this to change. Then the mandatory training in allergy management should be provided everywhere, because currently business staff lacks basic knowledge. So this is a risk factor for us, and therefore sometimes we have to avoid the public, which leads to social isolation and mental health risks. This could be prevented by targeted EU action on allergen management. Also, there's chemical triggers. Of course, everything is chemical, but we mean perfumes, washing detergents, and certain types of clothing, which can trigger symptoms. Personally, for example, I am affected by washing detergent, and I still didn't find what is causing it in it. Therefore, we need more digital information tools, which can supplement the on-package labeling. Then we're already coming to the policy recommendations. What we really want from you is to support the EU zero pollution ambition, the renovation wave. We want you to address climate change with at least 60% reduction target in 2030. We want a harmonized PAL system on pre-packed food across the EU, and regulation and control of allergens, sensitizers, and irritants in consumer products. Also, last but not least, we want research, digital tools for handling environmental risk factors. Thank you for your attention.
Thanks a lot, Laura. Very insightful indeed. Now we turn to Juliana. Before doing so, let me just welcome the 30 or more participants that have joined us in the meantime since we kicked off. So our next speaker is Juliana Aslani, young allergologist from Albania, who will address the care recommendations. Over to you, Juliana.
Yes, thank you, Akis. As you said, I'm going to talk about care part and our recommendations on care, focusing mostly in digitalizing disease management for flexible and affordable treatment and care. As the other panelists has also said, allergic disorders prevalence is rising, especially in adolescents and young adults. This accompanied with higher asthma deaths and fatalities due to anaphylaxis in these age groups, and also a more impaired quality of life, there have been also reported higher rates of depression and anxiety in these group ages. So all these informations or data do reinforce the need to create and implement new strategies and health policies that have in focus young patients. Since we are talking about young ages, a generation that has actually grown up in this digital revolution, and are more than familiar with new technologies, why not to offer to them a new improved healthcare system by using digital tools? It allows an easier, flexible, and direct contact with the healthcare professionals or with the allergist itself, and it can also provide more educational content for them. By using digital tools or e-health, m-health tools, we can improve the disease management by offering a more personalized action plan and better adherence to treatment, also an improved symptom monitoring using mobile apps and monitor daily symptoms of the patients anytime and anywhere they live, work, or study, with less inequalities on the care provided. The next slide. So we are talking about digitalization and we are talking about digital tools, but there are a lot of digital tools or mobile apps in the market today that are used for allergic diseases. We have to offer to the patient some kind of apps or digital tools that can bring improvement in their life, that can bring improvement in the self-management process of the disease. So there is need for a more harmonized European Union legal framework for healthcare for two specific reasons. The first one is offering, like I said before, higher performance by these apps. And the second one is also more than important, because we want to be able to protect patients' personal data by using these apps. How can we realize, or how can we do something like that? Strategy is a combination of the patient's perspective from one side, and the other side combined with current guidelines and healthcare professionals' experience. After discussing digitalization, we also have another important topic, which are the financial hardships due to high healthcare costs. Allergic disorders represent a chronic disorder, so they are accompanied with high direct and indirect costs for the patient itself, but also for their family members and the society. There is a lot to change when we speak about healthcare reimbursement policies within the European Union, and there are a lot of things to be changed or to improve. But what we really want to focus, or to our goals are, first of all, creating a unified reimbursement policy within Europe that can offer a better and more access to healthcare services by all young patients. But in the meantime, it can also provide less bureaucracy and less inequalities. Also important is the full coverage package, at least of the basic medications of allergy, because we think that this could at least reduce a lot the direct costs regarding the medication. And also, not to forget, important is the research, the scientific research, especially on the innovative and efficient ways of treating and managing allergic diseases, and new and cheaper devices for them. Next slide. And to conclude, all our recommendations actually want to highlight the need for a new healthcare scheme that must be a fit for youth healthcare scheme. Why a fit for youth healthcare scheme? Because as we all have been mentioned through our presentations, young patients have different and specific needs compared with other ages. So there is need for another kind of approach, and a multidisciplinary approach that can help them improve their quality of life, and that can also help them support them in every aspect of the allergic disease they do have. So a Fit for Youth healthcare scheme can offer a personalized strategy of controlling and managing the disease, but it can also make smoother or easier the transition process for young patients from parent-derived to the self-management of the disease. It can also help by using digital tools, create an active monitoring system, not only for the symptoms, but even for the adherence to treatment. And not to forget is important, even the evaluation of the psychological and emotional burden that allergies do have in young patients' life. Again, not the least one, but very important, is research on better ways of diagnosing, managing allergies, so we can help and make young patients live better lives. Thank you all for listening.
Thanks a lot, Juliana. Thank you so much for your thoughts. I think that closes the loop of our three pillars. The three speakers, I think they presented a quite ambitious but realistic set of recommendations reflecting the ideas of young patients. Now, your recommendations have concrete points on what needs to be done, but how can we bring these recommendations into reality? So I propose to move precisely onto those action points and to understand better how do they fit into the ongoing trends, for example, in allergy and asthma health, and what are the developments that might define them. So we do have an excellent panel now with us that will address these and other questions for us. I will briefly introduce our distinguished panelists while asking them some questions. What I suggest to do in terms of procedure is to have 2 rounds of questions where the panelists will be able to share their reflections on the key aspects of the recommendations, while also drawing a line towards current realities in allergy and asthma health. So if you agree, I would like to start with you, Mr. Nikos Papadopoulos. You are a professor of allergy and pediatric allergy at the University of Athens in Greece and the University of Manchester in the UK, but also a former president of YAKI. So Mr. Papadopoulos has also kindly accepted to be the senior scientific advisor of this of the Youth Parliament project, and we deeply thank him for that. Dear Nikos, so you have read the paper. Can you give maybe an overall assessment? What do you think it is necessary to be done to turn these recommendations into reality, and how do they fit into the current trends, such as digitalization, for example?
Thank you very much, Panagiotis. And actually, it is my privilege to be able to congratulate, first after the official launch, this great group of people who have produced these recommendations that are really realistic and ambitious. I would also thank and congratulate IFA for organizing this. And of course, our champions, Mr. Alekas, Mrs. Pietikainen, Mrs. Metz, that will transmit these messages to the Parliament. And I think an important aspect of making these a reality is actually transporting these messages to the Parliament. So I think the overall recommendations have these characteristics. They are really feasible. Some of them are more straightforward, others might be a little bit more challenging. However, there's nothing that's there unrealistic. And I mean, I can give you some examples in terms to, for example, you know, the EU is already facilitating movement. Movement is really very important for information. In the rules for facilitation of this movement, you can actually add the fact that about 20% of young people that move to study, to work here and there would be allergic. So or asthmatic. So this type of information can be easily implemented, and it can have an impact directly from the recommendations. Or, for example, the EU in the past have had this European Innovation Partnership. They had a very successful innovation partnership in active and healthy aging. Actually, they can generate this gathering of best practices for information. They can make Living Life in Full for Youth Innovation Partnership, this type of approaches. And of course, I will need to come back to research. It has been an important aspect from all the three pillars: inform, prevent, care. We do need research. Research is the key. And actually, we have found, we have experienced nowadays what research can do when enough resources are put there. With COVID, in a year, we have managed to solve the problem. So we need to put, as Europe, we need to put more resources into research. We have to be problem focused. We need to say, we have to solve an aspect of allergies. This year, we have to put resources to do that, and we can do that. And examples are, for example, using registries, support European registries in order to be able to understand the size of the problem.
Excellent.
I have more to say, but I pass it back to you so that other people may speak.
Thank you. We will come back to you anyway for further insights. Thanks a lot for this recap for now. We're also honored to have Mrs. Joanna Gacke, professor in allergy and clinical immunology, who is also an immediate past president of YACI and an experienced healthcare professional. So Mrs. Agake, Professor Agake, the Commission recently presented one of the key policies in the area of health, the new pharmaceutical strategy. What does this strategy bring when thinking about a cure for allergy and asthma?
Well, I will certainly go to this. Thank you. But first of all, I'm very enthusiastic to be here with IFA again and see how the interest group that we started many years ago is growing so nicely. So I'm very happy to see this happening, and all these enthusiastic people coming with recommendations and their willingness to support, to have better policies for allergy and asthma, starting from research to what is delivered to the patient. And this is what I'm going to share with you today in terms of the EU pharma strategy. So I hope that you all see the slides now. So we will discuss the fact that we start and we are really witnessing many innovative interventions for now, coming from precision medicine event, which is advancing quite fast. Also the applied research, which puts patient to the center, and also to the accumulation of real world evidence. Now we have new vaccines, we have these biologicals that are currently being developed, and we also go even one step further to the cell therapies, and we never forget about the health economics part. The problem is that there is no clear pathway from research to the final product, and there is low accessibility. New products, innovative products are unavailable or unaffordable. And the last thing, which is very important, there is very few investment, and this, I think that the poll that you started with showed that the investment into allergy and asthma is less compared to other chronic diseases. And I really think that this group of young people that are going to work together here will do even more pressure to have their voices heard. Now, in terms of what we need to do to achieve this goal is to align the research priority with the needs of the patients. This is extremely important, and also align with the needs of the healthcare system. And we have to balance between and to start to do this global multidiscipline partnership, which are very important, introduce the innovative health IT. I was very happy to hear that digital health is top priority and the recommendation of this group, and also rethink how we deliver healthcare. So between the research priorities and the policy priorities, because we are here both on both sides here in this virtual meeting, we have to define what we wish to do, agree, and last but not least, implement. Because we want to give the right medical care at the right time to the individual patient. This is extremely important. And we have here a variety of stakeholders, starting with the patients. I would put them first, and it's very important, working together with academia, with policymakers, with regulators. And we all need to agree on the set of recommendations and on what we are going to implement. Of course, we have a lot of tools in terms of research, starting with omics to real-world evidence coming from registry, bioinformatics, biobanks, and so on. And we need a lot of coordination here. Now, this new EU pharma strategy that is putting now in place has a very nice motto, which is innovative medicines for all. So the new health technology assessment regulation that we hope will be further implemented will facilitate achieving the better pathway from the research product directly to the patient. But for this, we need to have evidence-based investment in innovative health, bringing always an added clinical value for the patient. And for this, I would strongly advise that we do a little bit more to revise the legislation for medicines for children, because as you know, the pediatric asthma research is lagging well behind the adult asthma research. Also looking at the products that work specifically for allergic diseases like allergen immunotherapy to address the unmet needs here. And as I was saying, improve collaboration, both to tackle the unmet needs and to generate more evidence which will convince people that we are following the right pathway. For this, we need several things to be implemented. First of all, we need this scientific advice on how clinical studies are designed coming from academia. And for this, the extremely important is to militate even more to establish a European Council for Health Research. This is extremely important, and also to further develop or to expand the European reference networks from rare disease to other chronic diseases like allergic diseases and asthma. So I think that this fits very well in these goals that this group is having. It fits very well into the innovative EU pharma strategy that is there. Just to make a transition to another thing and to show you how our academy is tackling the other topic that is extremely important, the EU Green Deal. I don't want to steal the show from the next speaker, but just to show you that we have a working group on One Health, which is extremely important concept nowadays. We developed recently a concept on the role of the exposome in allergy and asthma, but the newest thing that we are going to do is to develop the next EACI guidelines will focus on environmental science application in allergic disease and asthma, focusing on 5 extremely important topics: atmospheric science, ecology, with a special focus on biodiversity, social science. We heard about people moving here and there and the concept of regiotypes, regulatory science, which is extremely important, and of course, models of causality. And with this, I close, and I'm happy to take any questions and discuss further with you today. Thank you very much.
Thank you so much, Joanna, for sharing your thoughts as well. Now, I'm also glad to welcome Dr. Carmen Rigioni, Chair of the EACI Junior Members Assembly. Carmen is joining us from a time zone 7 hours ahead of Central European time. So thanks a lot, Carmen, for this. So our members report to us that sometimes there are difficulties when transitioning from primary to secondary care in allergology. What can we say about the current state of play in this regard?
Well, first, thank you very much for inviting me to this event. It has been very nice to be here with you and see all these recommendations and all these very enthusiastic young patients within a European level, but I am sure that there are many others from all over the world. So I will share now with you my slides. Just here. So first of all, I think it is important to say that primary to secondary care transition in allergology is complex. So most patients seek attention first in primary care, and there is a low number of trained allergists within Europe and within the world that can cope for the growing demand of this specialty, right? So it is easier and it is more accessible for people first to contact their GP, the pediatrician, pharmacists, nurses, or other allied health professionals. And within IACI, what we are doing now is that there is a growing section of primary care and allied health. And this is aimed at increasing awareness of the allergic disease within all healthcare professionals, and also to continue education for healthcare professionals, for pharmacists, for nurses and nutritionists, dietologists, and other healthcare providers, and also for the patients, right? So this is very important. And another important tool is that they need in primary care to have validated diagnostic algorithms and also standardized patient management plans. So I think these tools would aid them in better managing the allergic patient within primary care. The state of allergology within Europe is complex. It is very heterogeneous, as you can see in this map here. Some countries which are in green have the full specialty, some countries in yellow have it as a subspecialty, and some countries in red don't even have it as a specialty at all, right? So why is it important that people be seen by allergists? It is important because it is more cost effective. In the long term, it will be better to solve faster the diagnosis and get to a prompt treatment for these patients. And this will result in an improvement of this patient's quality of life, right? So within Europe, we would need to harmonize allergy services, increase the availability of allergy specialists, and invest in young doctors, young physicians, young healthcare providers, and create opportunities for them to be educated within the network, the European network. And of course, to lobby for the full specialty of allergy. So what do we do within the, sorry, I think I skipped a slide. What do we do within the junior member assembly, right? So that what do we do? How do we gain these opportunities for education, these opportunities for training and research of young physicians? So we have several programs that some of you in the call, if you're young doctors, nurses, pharmacists, and are interested in this, you could join some of our programs. For example, the mentorship program, which aligns you with another more expert allergies, the Allergy College, which is meant for undergraduate students. So all the university students that are out there here in this call, you can join us in this Allergy College, and we're putting forward some modules now for virtual education of undergraduate students, both in medicine and in sciences and other allied health specialties. We also collaborate with several journals to put forward also fellowships and scholarships that are applicable for all people who join IACI and become junior members. And I think it is also very important here to see how we have new technologies that will help us in this transition from primary to secondary care. So now with the pandemic, we have all been using technology more and more, and people are more open to having virtual sessions with their physician, right? So having investment in e-health will help us impact a broad section of patients with a wide range of allergic diseases. It provides high patient satisfaction, and it has been proven to be cost effective. It also enables remote delivery and a timely access to healthcare. So within IACI, we have a task force for mobile health, and there is a position paper with this that I have left the link here on the bottom. And they have also endorsed the Be Healthy, Be Mobile initiative that is seen by other international allergy societies, such as the World Allergy Organization and the American Academy of Allergy. So the idea is to create mobile apps and e-technology that is of good quality, that is useful for the patient, that is effective, but amongst all these advantages, there are also some limitations, and patient protection data, and the feasibility of having these apps done in different languages. And all of this is important, and it has been, it should be addressed by health providers and by stakeholders. So within all these different types of health that we can have web self-management, mobile health, trackers for inhalant, social media. We can enhance the research, we can enhance epidemiology, surveillance. It will be good for health economics, for public health, for clinical diagnosis, and also for treatment compliance. And it will result in, to facilitate safe management in a patient-friendly manner, to have real-time medicine and enhancing fast decisions, which is really important for youth patients today that will want fast results and they want answers to their questions soon, to improve the patient's quality of life, to improve accuracy of self-reported symptoms, to have positive effects. It has been proven also to have positive effects on lung function and exacerbations, also on asthma, and on better account of anaphylaxis episodes, to promote medication adherence, to reduce the overall cost of care, and to it's better be very useful to disseminate information and increase public awareness.
May I ask to wrap up, Carmen, a little bit, because we need to move to the discussion slowly. Are you done already?
Yes, I am done.
Okay, great. Thanks a lot, Carmen. Now moving on to the next panelist. So you have seen already Michaela Odemir. She is participating in this panel to Michaela, you will now contribute under a double hat, both as an IFA president and as a vice president of the Swedish Asthma and Allergy Foundation. My question is, 1 year ago, the Commission launched this its overarching EU Green Deal, which is an umbrella strategy to address climate change and environmental degradation. What are the main opportunities from this policy, in your opinion, and what can it bring for allergy and asthma patients?
Well, the EU Green Deal is our best chance to try to find a balance for our planet and health. It comes a bit late. We have lost much time in the last decades, so it's probably the last opportunity we have, something that the youth sees with great clarity, and especially if they live with a chronic disease. And for allergy and asthma patients, the environment is crucial for health and the well-being. At IFA, we are vocal on the need for better air quality, less chemical exposure, or a circular food system. This is why we are engaged on the EU initiatives on the Green Deal, such as Farm to Fork strategy, the Zero Pollution Action Plan, the Adaptation to Climate Change, and others. Both as IFA and through with the members of this interest group, we have a long advocated for a holistic approach, the so-called health in all policies. The Green Deal needs first and foremost to be healthy. COVID-19 is showing today how policy coherence across sectors is fundamental to ensure health protection. Health prevention should be streamlined in every policy, in food production and consumption, in climate change, in chemicals, in everyday products, and on air pollution. On top of that, the youth voice in the Green Deal processes has to become a guiding light because of the strong intergenerated dimensions on this initiative. It is a deal for the future and for the citizens of tomorrow. As Vice President of the Swedish Association, which is lucky to count on a well-developed young youth branch, I can assure you that issues of the environmental health, including air pollution, climate change, and cannibals, are youth #1 priority. I think you all know about Greta here from Sweden. To be clear, we are fully aware of the Green Deal's ambition, and it's just the first step. Now it needs to be rolled out, and we are hoping to see concrete policies first and prompt implementation then, as well as the positions in the European Parliament who choose to adapt for its legalization. And we look forward to their continuing engagement in the discussion in the future. After all, the EU Green Deal is a long-term strategy. We must make clear that the Green Deal is about our collective future, focuses on our vulnerable populations, and therefore cannot be unhealthy.
Great. Thanks a lot to the panelists for your excellent input. Now, actually, I would like to open the discussion to all of you for the next session, for the roundtable discussion. I would like to remind you that we also have Mr. Olekas, member of the European Parliament from Lithuania, from the Socialists and Democrats political group. Mr. Olekas has kindly accepted to participate in the discussion, but before this, just a few words about the process maybe. This is an open discussion, so everyone will have the opportunity to participate. You can do this in two ways. You can write your question on the Q&A function on the bottom of the screen, and I will read it aloud, or you can raise your hand using the icon in your menu bar, and you will be able to ask your question out loud. In both cases, please state your name, your capacity, and the question itself, always indicating to whom it is addressed to. Now, given the time limits of this session, I'm afraid we need to wrap it up in 15 minutes at the latest. We will try to address as many questions as possible. In case you face any technical trouble, just feel free to write on the Q&A and my colleague Max will try to help you. Now, this is the moment to open the floor for questions. I believe we already have one in the Q&A. This comes from Mr. Roberts, Graham Roberts. It is a great summary for this excellent initiative, Inform, Prevent and Care. What is the future practical EU activities that you would like to see to effectively implement these important policy recommendations? Mr. Olekas, do you have any immediate reaction to this question?
If you hear me, good
Yes.
afternoon, everybody.
Good afternoon.
Indeed, first of all, I would like to thank all and welcome for this event that is being organized today. I think that the involvement of all generations in policy making and health policy in particular is key to ensuring that this area serves for everyone. Regarding your question, I think it's really very important that we should strengthening our efforts in EU. You know this idea of European Health Union, which is currently being proposed, which in the initiatives of the European Commission, is to be very welcome. I think it's really very important regarding the asthma and allergy also. And we created in the Parliament the intergroup also for strong EU health, and this is very important that European health and its strength being with the day-to-day care of patients. The quality of the service provided daily, the resources available, and the research. The colleagues mentioned it, how important the research in this, and finally the professionalism and the knowledge of the professional. I think that the health union we are fighting for the EU in the European Parliament is one that sees health as a holistic for all our patients, and I think it's very important to have the equal accessibility and equal possibilities for patients in every member states here in Europe, in all fields. And chronic disease is very, very important because more and more younger patients we have in the European Union.
Excellent. Thank you so much. Is there any question? to Mr. Olekas or to the panelists?
I apologize, Mr. Panagiotis, that I should leave for 10 minutes for that another one.
Okay, excellent. I see there is a raised hand from Freya Ankes. Can we maybe unmute Freya and open her video? Freya is a member of the Youth Parliament.
Yes, thank you. Yes, my name is Freya Ankers.
We cannot see you, Freya, though.
Oh, no, I don't seem to be able to share my video.
Oh, there's no video. Okay. Okay, just go ahead then, Freya.
Okay. I'm the president of the Swedish Association of Youth with Asthma and Allergies. And I'm also, as you said, a member of the Youth Parliament. And I want to address Mr. Olekas. So we know you as a politician are championing for a European Health Union, signifying a stronger EU role in health policy. And I wonder, how do you plan to ensure that this ambition will be fit for youth and include young patients, especially with regards to their access to care?
I am mute or not? Do you hear me?
We can hear you, yes.
Oh, okay. Thank you indeed. Thank you very much for your question. I a little bit start to answer on this question when we discussed the previous question. I think that addition to what I said, that youth people will also benefit from a health union that guarantees regular quality health care for every in European, no matter where he or she lives with healthcare system he or she belongs to. This is very, very important. And more excellent research. We should talk a lot here today about research. Better resources, professional knowledges available equally across the union will also serve to research, analyze, and prevent allergies to ensure that they support, enable young people to live equal and full lives. The lack of scientific research, they say, especially in the high fight against the allergies and chronic disease, as well as challenging access to latest technologies and methods, is one of the biggest problem that European Health Union is trying to address. And I think that if we unite our efforts to have this more equal and more accessible healthcare, prevention, and research in all European Union, we will be more successful and create a better future for young generation.
Excellent. I also see a raised hand from Laura. Laura Stantz from Germany.
Hello. My question would be to Mr. Olekas as well, because we heard that Francesco.
Quite popular.
We heard that Francesco said that he couldn't take part in exchanges, and I myself, I could, but I really had problems with my health because the environment wasn't adapted, and also I didn't receive the treatment, I interrupted the treatment. So I was wondering, the EU is promoting programs like Erasmus. So how can you make sure that young patients with chronic diseases are able to take these opportunities as well without experiencing obstacles in getting long-term care treatment, what they need? Thank you.
Yeah, I think we should think this, that the healthcare without borders. And when we're talking about the health union, this means that every patient in every country can get the same quality, despite residents of one country or another. It's very important to create the unified, standardized healthcare and diagnosis, and to allow for the patients to accept to be involved or to get this service in different countries. I think that like you mentioned, the Erasmus or exchanges of students, and it should be the healthcare without borders. This is very important, and equal accessibility for everyone.
Excellent, thank you. There is one question for Mr. Papadopoulos. Hello, I am Fong from Safe Food Advocacy Europe. Thank you for the great initiative and recommendations. I would like to ask about the possible reasons for the increasing numbers of allergic children over the last decade.
Yes, so the allergies are not increasing during the last decade. They are increasing already from the mid-19th century. And all the different hypotheses that try to explain that, they suggest that we have a disturbed interaction with our environment, particularly with the microbes, with the microorganisms. So we are either too clean or we're either missing specific microorganisms, but basically we have lost the contact we had with the environment, and this is why it's increasing.
Great, thank you. There's also a question to Juliana. Which of your demands or projects regarding digitalization would you address first? Juliana?
Yes, can you hear me?
Yes, we can.
Okay. Thank you for the question. Talking about digitalization, actually, we first of all wanted or have recommended an implementation of digital apps like mobile apps or mHealth or web-based health-related programs. So this is the first one we recommend because we think that this is a new way and of helping young patients in the self-management of the allergic diseases. So offering to them a standardized mobile app to help them accessing symptoms, accessing adherence to treatment, and helping manage their disease. Firstly, want to be implemented.
Great. Thank you, Juliana. There's one question for Michaela. Is it possible for IFA to work with the Commission and the European Parliament to add some allergenic pollen as cypresses, birch, grasses, and ragweed in the list of pollutant regulated parameters? It is important to increase the efficiency of the national networks and to increase the prevention of the patients, young and older.
Yeah, I think it's a great question. It's very here in Sweden. It's very how do you say, very hot topic now because we have problems with pollen counts. But I think IFA could do something. We need to advocate and see because it is needed because people travel abroad and they need to know also the pollen count where depending on where they are going. So I think this is something for IFA to look for in the future.
Great. I do think we have a couple of more raised hands. I am afraid they will be the last ones that we will take. I see one from Francesco.
Yeah, here I am.
Hi.
My question is for Mr. Olekas, and I want to ask about digital transformation. I mean, which kind of approach we can have with this new changing, and how EU can use this new approach, such as apps, such as many other ideas to involve young patients and maybe change the situation.
I thank you for question. I think it's you today event and your declaration and recommendation is very important for us as politicians to press to found the common theme or unity between the different political groups and to act together. I think that new technologies involvement, digitalization, accessibility, it's really very important to have our unity and the possibilities to act in the future, involving more and more patients and physicians as a holistic approach for solving this very important problems.
Okay, and I think there is another raised hand from Lise Ongier. Can we unmute Lise Ongier? Okay.
Yes, thank you. Can you hear me?
Yes, we can very well.
So I'm chair of the primary care working group at IARCI, and I just think it's really important, as one of the members of the IARCI task group on adolescents and young people, we've done some guidance on that, which I hope you'll find interesting. But specifically, the question is, we're happy to support from primary care and be involved in any further meetings, but how do you think, how do the adolescent members here and the other group, how would you like to involve primary care? Because it's often the front line, we're often the first people you see. So we would like to get this right.
Any immediate reaction to this? I understand that this is addressed to the youth members.
Yes,
please.
yeah.
Well, we actually think that it's right what you said, that the primary care is the front line. So I think that when I say in the digitalizing part, for example, when we say that the strategy of creating standardized apps is a collaboration of patient's experience, but from the other side, healthcare professional experience, I think that you are included in this part. Also, we think that more educational or training programs must be implemented and must involve not only young allergists and patients, but even the primary care professionals, because they are a part of the medical system that gets to treat or to maybe diagnose allergic patients. So it's an important part of the system.
Okay, great. Well, we're happy to do anything we can to support. And if you give us any more ideas, you know where we are.
May I also say something about that quickly? Just that, like for me, myself, I experienced barriers to go to primary care in different countries. Not that there was an actual barrier, it was just perceived. So when I was abroad for my studies, it would have been helpful to address that somehow, to have some maybe English speaking content for young people to go to primary healthcare maybe. So I don't know what to do, the exact step, but so you have less barriers. Thank you.
Thanks.
So we can maybe take one last question. This is for Joanna Gake. So the new challenge of allergic people who need to be vaccinated against COVID might be a great opportunity to act all together as Europeans to allow everyone to be immunized. Any reflections on this comment?
Well, I know where it comes from because we have the data that were released and the discussion that started yesterday. We still do not have enough data to comment on this properly, so I would refrain from making any recommendations here. But again, I agree that we have to fight for the full rights of allergic people to be treated and let's say integrated with all the interventions, not only for COVID. So we have to make sure that we are equally treated for if you have allergic disease than us.
Excellent. Then we need to bring this, unfortunately, to bring this discussion to an end. We are collecting the other questions as well, and we are happy to address them. maybe in written form later on, or address them to the ones that they are addressed to in the coming days. Many thanks to all of you for a lively and engaging discussion. And apologies for the questions that we did not have the time to take. As a closing session, we are honored to have the chair of the interest group, Mrs. Sirpa Pietikainen, who will offer some concluding remarks to wrap up this event. Well, in addition, Mrs. Pietikainen, in the beginning of this event, we held a very quick poll asking participants, to what extent do you think that the EU is addressing allergy and asthma? We had very interesting results, but along with your closing comments, would you maybe like to reflect on this issue too? Over to you, Mrs. Pietikainen.
Yes, indeed. Hello to everybody. And first of all, let me apologize you that I could not follow the whole of the session because I needed to be negotiating in the trialogues about the prospectus directive. And that came quite suddenly, the timing just overlapping on this. But I'll make sure that the people that have been organizing this event will send notes for me. Want you, please. And so we can sort of continue from that. And I've been following it passively on the, so to say, with the other ear. And the second apology is that you are going to only hear me because my network connection due to this another connection is so poor that if I put the video connection, it will cut me off immediately. But anyway, let me assure that I'm not a bot, I'm a human being. And I'm very committed to work with allergies and asthmas for various reasons. Firstly, it is very common disease and underdiagnosed, undertreated and underestimated because there's still a lot of this kind of an attitude that if you are not going to kill yourself immediately on an asthma attack, then probably it's nothing serious. And yes, it is very serious for the condition, for the life quality, and indeed, without proper treatment, it might get worse and indeed cause life-threatening situations. And it is serious also because it's a symptom about how the health and the environment has the interlinkage. We have a quite extensive study saying that the loss of biodiversity and nature connection is one part of causing allergies and asthmas. Second part is the over-chemicalization of our environment. And so it is not the cats and the dogs and eating tomatoes and drinking milk when you are a kid. And thirdly, and in very great extent, and this is worsening of the asthma cases, also in different parts of the Europe with different patient groups. It is the air quality that worsens the asthma symptoms, but it can also be one of the leading actors on provoking it. So there are many reasons to act upon on this topic. And then I'm very excited for this event and hopefully very formal and informal way of cooperating with you in the future, quite literally building a new generation. Because if we think, firstly, the almost 1/3 is the exact figure of children and young people having allergies and asthmas. So they need attention, but the conditions might vary, be different from other age groups. And so young people and children need a special focus and special attention, and they have special issues, like it is with the affordability of the care on the children, the ability of the diagnostic capacities and starting a proper and good treatment early on, or then in the fact when we are talking about the young people having a proper treatment that is fit for the purpose with the sports, different kind of lifestyles. And as indeed, as I could hear your comments about the pan-European healthcare systems when you are studying or working or just in travel in other member states, what is your possibility to have the access to general practitioner and to needed healthcare. And in a way, this building a new generation shows the fact how much we would need more European approach and competencies in the healthcare. And I think that allergies and asthmas are a good candidate to expand the reference centers from rare diseases to exactly the opposite, on extremely common diseases, to level on European level the good quality of treatment and benchmarking the good practices and medications, and indeed setting the standard and possibilities on having the treatment and care in other member states. And then if we come back to the environmental issues, the air quality, the biodiversity, or that matter, chemicalization, quite rightly, the people being in the age of 4 years or 14 or 24 are those ones with higher life expectancies. And that means much to look forward when it comes to good treatment, good air quality, or vice versa. If we do not take these to take care of these points, actually that will mean that quite substantial part of people in younger generation will suffer about asthmas and allergies throughout their life, and then later on the consequences that can express themselves on cardiac problems or pneumonias or other cases. Then the fact is that for young people that are independent, quite often in many member states, the healthcare costs can be too high and in some cases unaffordable. And that's why we would need to find special ways to compensate or secure the access to affordable treatments. So, and there are many other issues, but sorry. So yes, I do know what the asthma is, and it's very mild on me, but sometimes it's causing some issues. So thank God it's not COVID. What is the attempt and purpose for this kind of a networking and having this kind of a subgroup in interest group of young patients of asthmas? It is to build the knowledge and the platform for you and your concerns and your points of view. And our role is to be the ears and the listeners, and then the practical solvers of these issues, how to take care of pan-European health systems, or how to take care of early diagnostic, better capabilities or other issues. And so I do hope that this has been a very good start for this kind of a dialoguing. I do hope that you have a possibility to have this kind of a groups in member state level and raise your voice on member state level also in the cases of the care and the care needs and the environmental needs to secure good health for everybody. But I hope that you will come together across the Europe and send a strong signal to the parliament, and you work with us MEPs in the parliament to push these issues forward in the agenda, in the health agenda and Europe, EU's agenda. I really look forward for seeing this initiative to grow further, attain new milestones, and being a good partner for the interest groups. And so on behalf of the whole group, I just would like to thank you with a great thank you and well, wish to thank the European Federation of Allergy and Airways Disease Patients Association and the European Academy of Allergy and Clinical Immunology for your support and coordination in running the secretariat of this interest group and making this event also the possible. I'm looking forward on hearing and seeing you in the future. Thank you a lot for your activities. Please stay safe, take care of yourselves and your nearest and dearest and the other people too, and have the best Christmas or very merry season's greetings the way you wish to have them. With all the best. Thank you.
Thank you very much, Mrs. Pietikainen, for these kind words and this address, but first and foremost for your leadership in addressing these issues, and also your leadership in for this interest group all these years since its foundation. It's in 2015. I would also like to thank everyone for taking the time to join us for this launch meeting, and also for taking some overtime, staying with us, bearing with us in the last 10 minutes. A special thanks goes to this fantastic group of young patients and medical students and professionals for their great work and great vision. As mentioned, the recommendations have already been uploaded in the interest group webpage, allergyasthmaparliament.eu. As it was made clear during the event, we consider this as just the first step of a long journey, and we want them, as well as all of you, on our side. For the young patients and doctors in the room, if you wish to be part of the Youth Parliament, please contact us. For the rest of participants, please let us know if you wish to support the EP interest group on allergy and asthma by writing an email to the contacts on the slide that you will see here exactly. We hope that this event has been useful and inspiring for you as it has been for us. We will follow up with all the participants for the untaken questions, but also with the link to the recording and the event report, but also the recommendations, of course. Now, many thanks again, wishes for a nice afternoon, and season's greetings to everyone. Stay safe and healthy. Thanks a lot.
Thank you.
Bye-bye.
Bye-bye.
Thank you so much. Thanks, everyone.
Bye.
Bye. Thank you.